Hello there. I'm Dr. Srishti Mohapatra, and I'm one of the internal medicine consultant and aesthetic physician. And I also lead the research and development wing at India's biggest longevity and aesthetic clinic chain. In this review, it is not just only for the business owners. It is also about the patients so they make smarter decisions and smarter selection of what exactly do they want. The ease of use, the tech breakdown, patient suitability, speed of results, training support, satisfaction, numbers on the costs, financing, profitability. Let's talk about the Ultherapy. The tech and the ease here is it creates micro focused ultrasound with visualization. Real time ultrasound imaging pinpoints the exact depth for precision of each and every practitioner. Touchscreen interface, of course, full new colored screen boosts more accuracy. You know where you're actually entering. The SMARS or maybe the dermal layers, everything is in front of you. Coming to the certification point for practitioners, generally a person who has been trained in Ultherapy are more competent in 1 to 2 weeks within the certification. Now, the most ideal patient selection here is for mild to moderate facial or body laxity. That can include your jowls, brows, and neck in 30 to 60 seconds per line. Generally, the therapy is done for all skin types 1 to 6. This therapy is not for severe sagging skin or thin skin. Now, let's talk about the downtime. Well, the downtime is none really. You can just have some tenderness or swelling within 1 to 2 days, which can reside down on its own. But the downtime is nothing on the surface, and it generally does not show up on your face apart from the redness. Now, the results are visible tightening, which you can generally appreciate in 2 to 3 months, and it peaks around for 4 to 6 months in 1 to 2 sessions per year is what a patient would need. So basically, one session is something which is 70 to 80% people are satisfied with by 9 months. And then for the second session, you can have a top up after 9 to 10 months. Now let's talk about the per session charge that we have here. The per session charge here can go around somewhere around from 500 pounds to 1,000 pounds, which varies from one clinic to another and your location of the clinic as well, where you're actually practicing. Now, talking about from business point of view, acquiring this machine. So the financing via the distributors has high margins, 70 to 80%. Ease and precision of the doctor and the practitioner. Generally, the tech and the ease is really simple. The real-time ultrasound imaging pinpoints the exact depth for precision. At screen interface, new full color screen boosts the accuracy. New practitioners are generally competent within 1 to 2 weeks with certification. Now, let's talk about the kind of work that Ultherapy generally does. Whenever we are going to put one line of Ultherapy into any area of the skin after marking, we are putting that energy for denaturating the existing collagen, which is creating a laxity on the face by inducing new collagen, which is also known as neocollagenesis. And whenever the new collagen is formed, it makes your face tighter and it creates a better jawline and enhancement in your facial features as compared to other techniques, which is not that precise. Of course, according to clinic owners, it is going to be a huge investment. But again, the kind of results that we are expecting with this machine is brilliant because it is a one off treatment or maximum 2 treatments per year, after which the patient is left satisfied within next 3 to 6 months after having this treatment. Now let's talk about who's the best patient to be going for the L-therapy prime. People with moderate to mild laxity of their face, somebody who wants an enhanced jawline, reduction in their fat layer, and has to have a better skin texture with new collagen induced are the patients who should be going for L-therapy prime. All right, so we need to know who is an ideal patient, which we talked about, and who is not an ideal patient. A patient who's pregnant, has epilepsy, should be avoiding this. Apart from the patients who are actually diabetic and hypertensive, can actually go for this therapy because it is non-invasive and the healing is faster than any other invasive treatment. Now, people who have pacemakers should not be indicated this therapy. So overall, when we talk about this entire thing, Ultherapy, in my vision, is one of the most precise machines, and real-time ultrasound imaging is something which is very pivotal for practitioners and clinicians to make precise decisions and also deliver precise lines and shots, which also leads for all of us to reach the exact layers of SMARS and dermis. So Ultherapy, of course, it is going to be expensive, But you can generally get the return of investment from these patients who are from 150 to 250 patients. And after that, it's all a profit for most of them. So, Ultherapy is generally something which is one of the most pioneering machines and products for regenerative aesthetics. The best part about Ultherapy is it is one of the only technologies and very few technology which is doing a real time visualization into your sparse and deep dermal layers. It is also going to affect your fat layers near your jowls and your entire chin area, where you can actually work with precision. No other machine is actually showing any real time visualization. So that is where precision medicine comes into play. So, Ultherapy to any owner, even if it is going to be an expensive bet, is something which each and every clinic which is in a ground to actually put more money into it should be acquiring.